Hey everyone, it's Dr. Jason West at the Thursday night live cast, and I'm so excited to talk about arthritis. And man, do we have some neat things to talk about. And the first thing I wanted to tell everybody is almost everyone's suffering from arthritis. I mean, what that means is arth means joint, itis means inflammation. And so when people come in and they say, hey, I got a tennis elbow, well, that's arthritis. I have back pain, well, that's arthritis. Or I have pain in my hip, well, that's arthritis. And basically it's affecting anybody over the age of like 30. What's happening is the joints are supposed to come together, or not supposed to, they're coming together, and we call that hysteresis or creep. And this is why when people say, you know what, I used to be 6 feet tall and now I'm 5'10", and that's what happens is we're losing the space in between the joints, and it can hurt. So what is arthritis is like there's 100 different types of arthritis or diagnosis, but there's really 6 types, and this is what we're going to talk about. And by the way, if you perceive value in the video series, please like and share it and comment. We're actually doing a really neat webinar in 2 weeks where we have tons and tons of arthritis information. We're going to talk about basically the 6 different types and what to do about it. And by the way, it's not just me saying it. Got hundreds of video testimonials on our website, Daily Dose of Vitamin H, or dailydosevitaminh.com. But here's the things that we're going to cover. There's things like traumatic arthritis, so when you dislocate a joint or you break a bone, it really, really hurts. That's one. Then you just get bone-on-bone arthritis. You're wearing out. I call it the rusty hinge arthritis. That's osteoarthritis. Then you can have autoimmune arthritis. You can have stomach arthritis when people's foods don't work right. Then what you can do is you can also have skin arthritis, so you get psoriasis or rashes. How you look on the outside is kind of how you look on the inside. So there's really just about 6 different types, but there's 100 different diseases and different conditions associated with that. So one of the first things that I tell people when they come in is, can you imagine a life free of arthritis? And I can, and I'm so excited to work with people that have that same condition or that mindset. And people say, look, this is what I've heard all the time. If you really knew how to fix arthritis, you would be a bajillionaire, or you'd be so busy. And the answer is, guess what? I am really, really busy. And it's not just me doing it. There's doctors across the country and all over the world that are doing this. It's that they just don't get as much pub as running an arthritis medication. There's so many different things that are a blocker, a stopper, a painkiller, anti-inflammatory, and guess what? Those have some unwanted side effects. Many times the side effects can be just as significant as the disease or the condition. And so the arthritis, some tips that I'd really like to. And again, we're so excited. We're launching a whole webinar system next week, or 2 weeks, and it's free of charge. I'm so excited to be able to share. We have 100 minutes of recorded video on ways to help autoimmune arthritis, osteoarthritis, traumatic arthritis, psoriatic arthritis, which is skin arthritis, and stomach arthritis. Now, one of my favorite tips to tell people, and this is just a glimpse of what we're going to get into, is there is a specific food that is so important for the nodules that happen on your hands when you start developing, they call it a gull-wing deformity, or what they call a Heberdine's nodes. And that, my friends, is pecans. Raw pecans are so helpful for hand arthritis. It's also pretty good for feet arthritis in bunions and stuff like that. Now, there's a mechanical deformation that happens in bunions, so it's not like you can eat raw pecans and make it completely go away. But it significantly reduces the inflammation. So I tell people 6 to 10 pecans every day is so good, such a nice clinical tip for arthritis. And so many people, once they discover the mechanism of balancing, of basically putting a fire extinguisher and extinguishing the pain associated with arthritis, and then we want a lubricator, a shock absorber. Excuse me, I can't believe I had to sneeze on my live cast. A shock absorber, a lubricator, and a garbage collector. There's some natural things that can go into the joint and then they can get rid of it. So when I say get rid of it, they can make a substantial difference without having to be on aspirin or non-steroidal anti-inflammatory or prescription anti-inflammatory or a painkiller. And so a couple things. I just wanted to show this video that we're getting ready to queue up is a West Clinic highlight video of people that we have been helpful with arthritis that goes back over 15 years. It's something that takes you every single day. Someone comes in with carpal tunnel, low back problems, neck problems. You're going to see Shirley's testimonial. You'll see infection arthritis. You're going to see Carrie's thing coming up. And we're just getting ready to share with everybody in our system, in our group, how we work with arthritis. It's a free mini webinar that's coming up exactly in 2 weeks. So 2 weeks from tonight, mini webinar. But let me just show you some of the highlights of people that we've been working with. And here it is. Check it out.
And I've been coming down, I guess probably this is 6 years now. And I get shots in my shoulders and my neck, my back, and mostly it's for arthritis. And it's just been wonderful. I can't say enough for Dr. West on this. I mean, they've made my life to where it's basically manageable again.
I have bad arthritis right here. Eventually I would not be able to play anymore.
Okay.
And now, thanks to this man,
Yes.
I can play better than I ever did.
When I came up here, I was in so much pain. Walking, any type of daily movements, working was very difficult for me. I had not worked for about a month and a half when I come up here. And after my very first series of shots, I was able to go back to work, and the improvement's just been drastic.
Introduced to the ozone therapy, and with the ozone therapy, and it sounded like exactly what I needed, because my body goes through, it's a high impact deal. You know, I have to be strong and in shape, but then I'm also riding horses, I'm trying to manhandle cattle, you know, all on a athletic deal. And you know, athletes pound on their bodies for years, and there was some issues. I was starting to have some knees, and there were some injuries that kind of seemed chronic, and so we thought we'd give it a try. From there, tried it, and I think we started with the knees. The knees helped. I've had my thumbs done. Lots of this injury, some of it preventative, seemed like my shoulder. Both my right shoulder's the one I swing my rope with. I've had it done a couple times, and it was starting to click, and it felt a little bit. And so the ozone therapy, along with the kind of a workout regimen, and my shoulder's good, and it kind of felt like it could have been starting to get a little sloppy. Left shoulder, got it done once, and it's been good. But the biggest improvement was on my right shoulder in that instance. The knees was good. I get them both done. My left knee seemed to be worse than my right, but since then it's improved. In fact, I think I get them less often now than I did.
Anyway, I started in about January having these shots once a week, and they're not for sissies, you know. But my back got better and better, and they changed me to a different type of pain med, and I've sort of got my life back. I'm feeling like I'm enjoying my business again, and my family, and feeling like, you know, it's. So anyway, I had 5 weeks. I had them injections each week, and then I went to every 2 weeks, and now I'm about every 3 weeks. I'll have 8 or 10 shots up and down the center of my spine, and like I say, it's not for sissies, but I think it's working, and I'm going to start tapering off on my pain meds and see for sure. But for now, I'm a whole lot better, and so that's what brought me to Jason.
Marjorie, when you first came in, what was happening?
Well, I was totally fatigued all the time. I couldn't move my arm real well because I have a torn rotator cuff.
And then there was some concerns about old viral thing. We were worried maybe some post-polio.
Yeah.
And then we also had some concerns about this little gland thing up here, here called the thyroid gland, which is so common for people to have, you know, dysfunction. And so we did a series of treatments, and Marjorie, you told me what?
I'm feeling better. I'm doing great.
And show them what you can do with your arm. This was amazing.
You'd ask that.
Well, I was to the point when I'd go to Walmart, I'd have to get in the cart, and it was very embarrassing because it was hard. I was in a lot of pain from just walking.
And it was funny because when I asked her, how can I help you? She's like, I don't want to use the cart at Walmart. And I was kind of scratching my like, what does that mean? But then she told me, it was kind of made me chuckle. She said, it's embarrassing. I don't like it to be in the cart. And so we did a series, I think we did 5 injections.
Yep.
And how does your hip feel now?
Wonderful. I can walk in Walmart and I don't have to use the cart, and I'm not resting every little bit or anything. It's nice to not have that chronic pain.
In January, I started getting terrible pains in my back and in my legs, and my leg went numb and my energy level went to nothing, and I was falling. It was hard to, I couldn't go up and down stairs. I just felt like my whole body was crashing.
And did you have a medical diagnosis? Did you go work with anybody?
I went to my doctor. She said she thought it was sciatic and sent me to physical therapy, and I went to physical therapy for 2 months but didn't see any improvement. And so then because of the swelling in my knees and stuff, she says, well, maybe there's something going on there. So she sent me to another doctor, and he took x-rays and says, you don't need a knee replacement. Why are you here? And I came home from that appointment and called you guys and said, I'm done with these people. Can you fix me?
And so you came up, and it's not exactly easy to get here, because you live how far away?
It's 2.5 hours.
Okay, so down in the Salt Lake region, and we came up here, and what did we do for you?
First of all, you started doing the Prozone in my knee.
Okay.
And
did it help?
We only did the one knee at first, and yes, it helped. It helped a lot with the pain that I was feeling. And that knee started feeling so good after several treatments that my other knee that has arthritis in it, I had to treat it, and I'm able to go up and down stairs. I'm not falling anymore. I actually painted 2 walls in my kitchen this week, and I've had 2 treatments on my back, and it's feeling a lot better. I think it helps a lot with my balance. I just feel like my whole body is coming back alive again, like I've just been in this cocoon and things are starting to open up and I can move and have a desire to work and do things because I'm not hurting so much.
Hey everyone, so I am so excited to share with you the information of what we did for all the people in that video. There's some commonalities that we have, and again, a special shout out to some of my faithful people here. Hi Tressa, Arnold Bird, Sarah Winbigler, Sherry Hall, Sharon Gould. I mean, there's just it's awesome to have the support every week. And so let me give you guys something that's really neat. If you'll put in #mini, you're going to get the free arthritis course that we're doing in 2 weeks. It's a webinar that we've put together with the secrets. And let me just give you some highlighted secrets. There's really about 5 things to do. If you have pain from osteoarthritis, if you have inflammation from rheumatoid arthritis, or you have an inflammatory condition related to your stomach, which we call enteropathic or stomach arthritis, there's a couple things that you can do. One, let's put out the fire, and this is so effective for many people. Now, some of you are already doing this, so don't get mad because there's other tips coming, and that is water. Water, water, water. It lubricates joints. One of my favorite doctors, Dr. Batmanjidi, was an Iranian medical doctor that was treating people with air, sunlight, and water inside an Iranian prison. And he wrote a book about it, and it was just phenomenal why water helps with so many different types of arthritis. Now, the second thing that we want to do is we want to avoid inflammatory stuff, and this is really hard because inflammatory stuff is really addicting. It's things like sugar, high fructose corn syrup, carbohydrates. I mean, some of those taste really good and they help us to feel good because they fire off our dopamine receptors, similar to types of drug therapy, and it's an addiction. And if you don't think that carbohydrates and sugar is an addiction, guess what? Go try and not do it for a while, and you can totally do it, but your body is going to go through a process of getting off carbohydrates. But here's the other thing. If you take away the fuel source, so many times people get better. And one of my friends, Barbara Bach in Chicago, that comes out to the office, she commented on here, what do you do for RA? And the things with RA, I see so many times, there's a food component, carbs and sugar are a component. Also, infection can be associated with it. Lyme disease, Mycoplasma pneumoniae, chlamydia pneumoniae, which is a bacteria that causes lung problems. Like, those are so common to see in people that have inflammatory arthritis. I don't think that all of the rheumatoid arthritis, it's not autoimmune. There might be a portion that is, but I'm telling you, if you get people off of inflammatory foods, you get water and stuff into their system, what happens is they start to improve. Now, we talked about a couple different foods that are really helpful for all types of arthritis. One was pecans, raw pecans, 6 to 10 raw pecans are really helpful in arthritis conditions. That's one. The other one that's really good is raw pineapple. It really doesn't work if it's dried. I haven't seen it work as well if it's frozen, and definitely not canned. But if it's raw pineapple, there's little Pac-Man in the pineapple, literally, that go around and they eat up inflammation. And then the other one that I really liked recommending is cherries, either dried cherries, frozen cherries, fresh cherries, or 100% pure cherry juice. Now, there's a lot of cherry juice on the market that tastes really good, and cherry's a good flavor, but that is not what is good for people. If your cherry juice tastes good, then it is not good for you. It probably has a lot of sugar or another type of inflammatory sugar that's inside of it. So it shouldn't taste very good. You can go over to the health food store and get a bottle of cherry juice about yay big. It's pretty expensive. I want to say, it's like $15 for something like that. But literally about 4 to 6 ounces of it, I've seen reasonable outcomes with it. Now, what I say by reasonable, it means like there's no like for sure thing that gets rid of everything. So you want to use all of it. Water, avoiding carbohydrates, especially sugar, high fructose corn syrup, and refined white sugar are the worst. I see less impact from things like honey and stevia and molasses and pure maple syrup. So you can get some taste into your foods, which, by the way, in our free course, one of the things that we put inside of that is we talk about the clean eating guide. Because if you're eating clean, it helps so much with inflammatory arthritis, osteoarthritis, traumatic arthritis, and skin arthritis. So if you're just joining us, we're talking about things we can do for arthritis. We just showed a special of basically how we're being able to help people for years. It's not just me saying it. We've been doing it for 105 years. And if you want to get a jump on everybody, we have a course. If you'll just write #mini in the comments, in 2 weeks, we have a webinar on arthritis where we go more into the nuts and bolts of everything, as well as the foods, the diets, the supplements that work, the supplements that don't work, many traditional medical treatments that are common. There's a couple medical treatments that are kind of nerve-wracking for me. There's some considerations in alternative medicine such as acupressure, acupuncture, perineural injection therapy, neural prolotherapy, neural therapy, regenerative injection therapy, prolozone prolotherapy, and we're going to go through all of those in our free course. So one of the things I'm really excited to share with you is a story of a patient that came from Colorado, a really good friend of ours named Carrie. And what's happening with Carrie is she came in and literally she had about 3 pages of single-page symptoms. Hey, this is how I feel of this. My muscles hurt. My joints hurt. They're telling me that I need a happy pill, or that they wanted to give her kind of the conventional medical arthritis drug therapy approach. It didn't do so good for her. So here's Carrie's story. I'm excited to cue this up, and let's check it out. Here it comes. Hey everyone, Dr. West and Carrie here. I'm really excited to share with you a cool story because people ask me all the time, can you help people to get over chronic disease and then keep them that way? And so this is a really neat story because we were working on Carrie's son Christian, and the first workup, it was Christian's dad and grandma and grandpa that were here, and I'm like, well, where's mom? And they're like, well, she's back in Colorado. And then Carrie came to pick him up and stuff, and I was checking in with her, and she said, you remember the last time I came in? How long ago was it?
It's probably been 6+ years.
Yeah. So
yeah.
when you first came in, Carrie, 6 years ago,
Yeah.
how did you feel?
I had a dishwasher, and I honestly couldn't even put one dish in the dishwasher. I remember that because it was like I went from being very active to my body just started to deteriorate, and I didn't know why. Actually, when I came to you, I had finally just started to type up my symptoms, and I remember I had 2 pages of symptoms.
2 pages, single-spaced. Like,
I remember I remember some of the last symptoms that really came on were like my hair was starting to fall out. Dizziness was the first symptom and always just a bad symptom. I remember going into a lot of doctors going, we don't know why you have dizziness. There's a lot of reasons for it. I even had the Lyme disease rash, and a doctor looked at it and didn't even say anything. My muscles were really tight. I was tired all the time. Just things where I'm like, this is bizarre. And yeah, just going to a lot of doctors and having pretty much no answers.
what did we do 6 years ago? What were the treatments?
Well, I did vitamin C. I remember hydrogen peroxide, right?
Right.
Is that right?
Yep.
Yeah. And I did a lot of IVs. I slowly got better. My family saw it more than I did. It was gradual for me. But it was so gradual that I started exercising like I used to. Kind of started doing too much and had to come back to which was a good thing in the sense that I was functioning again. I was moving again. I was taking care of my family again.
And so you came back, we
Yeah.
did some work on your son, and
Yeah.
just in our discussions, I said, how you doing? And you said,
I'm good.
yeah, it's so cool, because this is
Yeah.
exactly the goal of the office, is to help people to achieve and then maintain optimal health. And
Yeah.
it was like, I didn't have to really do anything. I mean, I just wanted to check in with you. And
Right,
you're
you're
like,
just asking.
oh my gosh, it's been years since I've been in. I'm doing great. And I'm like,
Yeah.
this is the perfect story of hope for someone, because I do think that you can take people that have chronic illness and chronic infections and Lyme, and if you build them up and make their body healthy, then you don't need me. And like, that's the ultimate
I
thing.
don't want to have to check in.
Exactly. Yeah. So how cool is that to say I don't need my doctor anymore after being diagnosed and having all of these symptoms, 2 pages of symptoms 6 years ago,
Yeah.
to saying
And
I don't need
plus,
anything.
I'll add one more thing. I never thought we could have another baby, and we have another baby. She's
right.
5 years old now, and that was not even in my scope at all.
And anybody out there that's looking for chronic disease or been diagnosed with Lyme disease or anything else, what would you tell them about the office?
That there's hope, and I love that Dr. J helps you learn what to do at home too. That there are therapies that work, and that you research them, and that this office knows its stuff. And there's a peace when you come in here. And it does. I mean, some people, to me, I've seen like my son heal pretty fast, and mine was gradual.
And then one thing that I wanted you to tell everybody about, because it was just before we started on camera and stuff like that, it was something that I wanted to teach your son. I want to know whose responsibility it is for his
It's not
health.
mine. It's not my husband's. It's absolutely his, and it's his. He needs to learn how to take care of his body. So.
And it was really cool, because
Yeah.
we really
Yeah,
resonated
not
with
mine.
that. Like, I
That's
know
true.
he's going to do that
Yeah.
when he goes back.
I do
It's
too.
really cool.
I do too. But yeah, he has to make the decision. It is his body, and he knows how he feels, and he knows when he doesn't feel good or not. He knows he needs to learn what to do, but it's his responsibility for sure.
So Carrie,
Yeah.
thanks for doing this for people. It's just a great story all the way around. I didn't know about your little girl, so that was really cool.
Yeah, it's
to
pretty neat. I
talk
know.
about.
You didn't, because I've been gone and haven't.
Yeah.
How would you know?
And so
It's
how
okay.
cool is it, again, to take someone that wasn't feeling good, help them to get feeling better, teach them the principles, and then to have them, like, one of the coolest things I've been told in the office, Dr. West, I don't need you. Like, I did it.
Yeah.
I really, really lived up to what the goal of the clinic is when you don't need me anymore. Okay, so Carrie, just wanted to double check. Can I put this up on our blog
Yeah,
and social
that's
media
fine.
and stuff like that? Okay, everyone, this is Dr. West and Carrie signing out for a daily dose of vitamin H at the West Clinic. We'll see you guys on the next video. So that's just a really feel-good story from Carrie from Colorado. You've seen so many people from different parts of the country and across the world that are getting help. And so let me help you to do some stuff at home that is really important. So we talked about, number one, water. And people say how much you should drink, and I say a lot. And one of my experiences has been like the type of water is important. You want as clean a water as possible. I like it filtered through a carbon filter. I kind of have some reservations about reverse osmosis and distilled water, but we'll pick that up on a different segment. I like spring water is the ideal water, I think. The problem with distilled water is it's hungry water. There's nothing in it, so I think it acts more kind of like an acid, and it leaches minerals from the bones and muscles. That's my opinion. I've had a discussion with some colleagues that think differently, and I'm open-minded to that. But when I put people on a distilled water diet or distilled water intake, I haven't seen them do very well. So I just have some concerns about distilled water. Now, let's talk about what you can do at home and what's inside your medicine cabinet, and a warning, because one of the cases that's really been tough this summer is dealing with a patient that was in the construction industry, was really hard on his body, and the way that he functioned is that, hey, I'm just going to take 4 Tylenol every day. And guess what? Now he has something called focal glomerular nephrosclerosis. Like, I had to practice that in front of a mirror to be able to say that, but here's what it means is the kidneys are hardening and they're going into failure as a direct result of the non-steroidal anti-inflammatory. And what that means is, you guys, you got to be careful with over-the-counter medicines. Just because they're over-the-counter and you're not picking them up at a doctor's office or a pharmacy or something, doesn't mean that they don't have an effect. And so now, later on in life, we're having to deal with a serious kidney problem that, unfortunately, we have some options there, doing some advanced, what they call proteomorphogen therapy, and there's some really neat things that you can do from an advanced nutritional standpoint for kidneys. But here's the concern with that. The concern is like, kind of didn't need to go there if you'll do this. Now, this was taught to me, and a shout out to my friend Dr. John Jones, who's a medical doctor, had a master's degree in public health, and taught me a whole bunch about nutrition. So shout out to John Jones. Number one is essential fatty acids, omega-3s and omega-6s. If you get them in high enough dosages, which is typically about 3,000 to 5,000 milligrams, it can act like a over-the-counter medicine without all the side effects. And how you make it work even better is you add a proteolytic enzyme to that, which means you add like a digestive enzyme that gets rid of protein. So if you combine essential fatty acids and proteolytic enzyme together, you can have a wonderful pain-relieving effect that lubricates the joints, it eats up inflammation, and it doesn't get after your liver and kidneys. Now, the only bummer part about that protocol that I just told you is it's not like aspirin. You can't take that and expect the relief. Usually it takes about 7 to 10, sometimes even up to 14 days if you'll get 3,000 to 5,000 milligrams of essential fatty acids and a good proteolytic enzyme. Bromelain is a really good one. Papaya and pineapple extract is another one. That's why I tell people that pineapples are really good. There's a little bit of it in cherries. But if you'll do that, it can really helps with pain, and then just keep doing it because it helps to insulate the nerves, it helps to control blood sugar, it really helps to basically help the entire GI system, and it's really good for your brain. Like, this is a no-brainer for anybody that is in pain. And then the other concern with some of the pain relievers and over-the-counters and the nerve medicine is it can give you accidental brain fog. So using the essential fatty acid approach is really, really helpful. I also like GLA, flaxseed oil, coconut oil, avocados are all considerations. Mix it with a good proteolytic enzyme, and there's a lot of things out on the market. Now, I like to use a couple different things. Number one, I like to use this Joint Freedom from Personalized OTC. I like it because it has some collagen peptides in it. And if you would like to purchase our arthritis pack, please put #joints in the comment section, and I'll send you exactly what I put together from the collagen peptides. And then this one is called Joint Revive, and I love this because it has a secret medicine in it. Now, this medicine is available on the market. You can find it different places. It's abbreviated CMO. It stands for cetyl myristoyate. I learned this in a lecture from a friend of mine, Dr. Hicks, that told me about CMO, and CMO is like supercharged glucosamine and chondroitin. Now, a lot of people take glucosamine, and I think it's a good, smart thing to take. Usually, you just have to keep at it, be consistent with it. CMO makes it basically like supercharged. And so it has a shock absorber in it, it has a fire extinguisher, it has a garbage collector that it goes in and revitalizes the joint. So if you put these two together, I've seen really good outcomes with it. Now, if you're not in a position that you need to order those from us or going to the website, and again, just put #joints if that's something you need. Here's the protocol: essential fatty acids, proteolytic enzymes. The other one that's really helpful for pain everywhere, especially for mixed connective tissue disease, fibromyalgia, polymyalgia rheumatica, is magnesium. I like to recommend somewhere, above that 600 milligram mark for magnesium. It's the miracle mineral. We've talked about it in previous episodes, so I really like that. And then the other thing that's so good for the joints is to make sure that you're getting vitamin D. Now, it's so easy to tell you what vitamin D doesn't do, because it kind of does everything. I mean, it's helpful for hormones, your immune system, for joint pain. It's really good. So research is suggesting that it helps to reduce the risk factors for cancer. And I really tell people, like, I like 5 to 10,000 units of vitamin D is so good. And there's a really nice baseline for arthritis, and that kind of covers the spectrum from osteoarthritis, rheumatoid arthritis, stomach arthritis, or what they call enteropathic arthritis, psoriatic arthritis, traumatic arthritis, and basically overuse arthritis. Now, that's not the only pathway. There's some other advanced nutritional considerations that you can do. And one of the things that we do in the office is we can actually go in and customize supplements, all of the different ones, into one bottle. We partnered with a natural pharmacy that allows us to do this and make formulations specifically for you. And we can really, really get dialed in. It's the cutting edge of medicine. I think in a couple of years, it's going to be what everybody's doing, custom formulations in the nutritional pathways. But you can do this, literally, most people have this in their medicine cabinet. They'll have some fish oil now, they'll have some vitamin D. The other thing that I like for nerve pain that's associated with arthritis, if there's continual irritation, is vitamin B12, both the lozenges and the different pills and stuff like that. And then let's not forget about foods. You are what you eat. So if you avoid inflammatory foods, it'll really help you with arthritis. That means being careful with sugar. That means being really careful with gluten. Sometimes dairy really aggravates it, and people say, well, man, that's what everybody says. No gluten, no sugar, no dairy. And I'm like, actually, it's a really good place to start. And a lot of times people say, hey, Dr. West, I tried that, and I'm not feeling any good. And I'm like, well, how long did you try it for? And they'll say, 7 days or 10 days, or every once in a while I'll hear a month. The literature on gluten is showing that it paralyzes the microvilli in your stomach for up to 90 days. So what's tough about recommending it for people is to say, look, I'm not trying to ruin your life. I'm not saying that you can't ever eat it. But if you're having a lot of arthritis, and it doesn't matter which family it is, if you will avoid gluten for 90 days, a lot of times people make a significant jump. And the tough part about that is it's not like a sugar diet or trying to lose weight diet where you can go for 2 or 3 weeks and doing pretty good, and then you go to your nephew's birthday party and you're like, hey, I just need to have this root beer float or a piece of cake or a brownie or whatever it is, and you have a sugar rush, and then 24 hours later your body kind of is over it. That's not what happens with gluten. If you go 40 days or 50 days gluten-free, and then you get some gluten, it goes in your system, and it literally starts the clock over again. I'm sorry to be the bummer bad news bearer if that's what's happening, but please give it a consideration. I've been gluten-free. I'm not completely gluten-free now, although I don't really have any healthcare systems, but I eat way less wheat than I used to, and I feel significantly better. It's really pretty rare that we get it into our system. So if you follow those examples, water, good food, proteolytic enzymes, Pineapples, cherries, pecans are such a miracle thing for the Hebridean nodes in hand arthritis. It's a good place to start. You can see some of the supplements we put together in our joint pack. If you need help with that, you can just do #joints. And then don't forget, like in 2 weeks, I'm so excited to share with you guys our webinar on arthritis. And I have been working on this for over a year. We have tons of information on what types of arthritis, what to do about it, the best things that you can do at home, the best supplements to take, the supplements to avoid, traditional medical treatments and alternative medical treatments considerations, and then how we get such good outcomes with arthritis. So that's got a real nice recap. I wanted to share with you one feel-good story about Shirley. Shirley's a dear friend of mine. I don't know how long it's been. I'm taking care of her. I think she was one of my first patients, and I don't want to say how long I've been in practice, although it's been 2 decades. And she was one of my first people. Had a horrible slip disc in her neck. Now, a lot of times people think, hey, well, a slip disc in the neck isn't arthritis. It is, because if you see the vertebrae here and the vertebrae here, there should be a real nice shock absorber that's going like this. If it gets too close together, what happens is now it starts to compress the nerve. It can get the dorsal scapular nerve that goes in between your shoulder blades, or part of the brachial plexus that goes down into your arm, or even pick up part of the cervical ganglia that comes up above the ear and goes behind the eye. So all of those distribution patterns can be part of neck arthritis. And Shirley came in, and Shirley gets after it in life. Like, she's motivating and inspiring to me. She rides a Harley, she's on a motorcycle, she's golfing, she's active. It's a really fun case. It's only a minute long, but here's Shirley's story of how you can help even neck arthritis. Check it out. Hello everyone, this is Dr. West. Just a really cool patient story. Walked in to take care of Shirley. I told Macy, hey, we go way back. And I don't know how many years it's been.
A lot.
It's been a lot of years. And Shirley said, oh my gosh, you totally saved my life. You fixed my neck. So Shirley, give us the real quick rundown. What was it like when you first came in?
I was in a neck brace. I could not ride in a truck or anything until I came here, and you helped by giving me the prolozone injections in my neck, and I've been coming ever since, at least once a year, and I get the package, and it's awesome. I don't need it now, and it's saved me because I don't get migraines or anything like that anymore.
It was just awesome. So it's a regenerative injection therapy. We take a little vitamin, some oxidative medicine. We work on the structures of the neck, and anyway, years after we started, Shirley just lied to us and told us her real age. I don't believe that that's her real age, because she looks amazing, and she's living, not just existing. So it's just a really cool case. It's okay if I put this up on Facebook?
Yes, and I still ride my Harley, and I ride my horses.
Can you believe that? So someone coming in that couldn't even use their arm or their neck, now riding Harleys and horses. It's just awesome. Cases like this make it really fun to come to work. We'll see you guys on the next video. Okay, you guys, so that's just a real quick experience with Shirley, neck arthritis. Now, I've got a couple questions in here, and I'm excited to address those. If you have questions about arthritis, please put it in the comment section so I can pick it up next week and inside our webinar. A special shout out to Lori Archibald, who wrote down the injections work. Thanks for helping me get rid of most of my pain. Also Leah Marsh and Beverly Atherley. And man, there's just so many people. Another question about fibromyalgia. And so a real quick review on fibromyalgia. The place I like to start with that is just cranking up the magnesium levels. Iodine is a good consideration. About 600 milligrams of magnesium is a good place to start. Essential fatty acids and the proteolytic pathways are really, really good. And then detoxifying the body with lots and lots of water. Those are all good places. Now, fibromyalgia, sometimes it's not difficult. Other times it's extremely complex. There's no one size fits all. There's a person in there. And the biggest thing is you don't want to be your diagnosis. You don't want to assume the label. So we're going to talk about some fibromyalgia stuff. I think that I just decided that's going to be the topic next week. Fibromyalgia, mixed connective tissue disease, polymyalgia rheumatica, all those, they kind of all comes together. Another shout out to my friend Denny Preston. Hey mama, I'm so excited that you were joining us on the podcast. Please like and share the video so that we can get information out, because the most important thing, or most important, frustrating thing, is when people come into the office and they tell me this: I wish I would have found you or a doctor like you years ago, because I wouldn't have gone down a pathway of keep wearing out, or getting beat up from over-the-counter medicines, or doing a surgery that I may not have had to do, which, by the way, like, I'm not anti-medicine or anti-surgery. It's just I like to exhaust the other things first before you ring the bell, because once you do surgery, you can't really put the parts back, and sometimes you need it, and a lot of times people don't. Sharon asked me, what does Prolozone do for arthritis? And Sharon, this is what we're going to cover in the webinar in 2 weeks. And remember, there's going to be a fantastic question and answer period. We've never done anything like this, where I'm just going to stay and go through questions that people have from all over the country, all over the world. We've had patients from, Abu Dhabi, we've had South America, we've had Russia, we just had a patient from Malaysia that was here, and we are going to go through as many questions as we can get through. It'll help us to be efficient if you put those in the comment section. A couple other things, remember, if you want to get pre-registered for it so that you get a reminder and everything else, put #mini in the comment section. If you need help with a joint program where we get a fire extinguisher, a shock absorber, a lubricator, and a garbage collector to get the junk out of the joint and to help and get that special medicine called cetyl-myristoyate, just put in #joints inside the comment section. So this is where we're kind of like winding down a little bit. I'm so excited to be able to do fibromyalgia next week, and then 2 weeks we're going to do the arthritis program, what you can do at home, what foods to eat. There's a healthy eating guide there. We're going to talk about what things that you can do at home. And for people that are not able to travel to the office, what we're doing is we even give you the option to design a protocol for your doctor. I mean, there's a little bit of an expense associated with that, but we have a setup so that we can actually make something so you can take into your doctor with the doctor's research packet. And the absolute Cadillac treatment, the top of the top, is we're actually starting to do custom formulations where literally you can go and work with a custom formulator and say, you know what, for Becky's formula that she needs to do, we can customize, put it all into one pill, you can do it into one bottle, and eliminates so much pill fatigue, which is another huge problem with arthritis. So many people are taking so much stuff, there's double dipping, it's too much for the system. And really, there's so many exciting things you can do for arthritis. We actually have a book that you can get. It's called the Curing Arthritis. Now, you're not really supposed to say that there's not a guarantee. I want to be really careful. I always say that. I modeled it after my friend, Dr. Tom Levy, who wrote a book called Curing the Incurable. And we said, hey, let's do something like, what can we do for arthritis? It's a free guide that's coming out in 2 weeks at our webinar on arthritis. And that's really everything that we needed to cover today. So remember, you're not your diagnosis. There's a person in there. Then there's so many things that you can do to control that. Get enough water, get healthy foods in your system, get your body on a schedule. Essential fatty acids, proteolytic enzymes are a great place to start. Magnesium is the miracle mineral. Vitamin D is so helpful for everything associated with ills in the body. I mean, I'm convinced that that literally does about everything. It's kind of my second favorite vitamin. I mean, vitamin C is my all-time favorite. That is the thing that I love the most to help people with literally just about any condition. But that is our segment for August 27th, 2020. Thank you so much for the regulars that are tuning in. And it's going to be really fun to talk about fibromyalgia next week, and then our webinar in 2 weeks, the arthritis program, what you can do at home, and how you can beat arthritis. This is Dr. Jason West signing out. See you guys later.